As their name implies, roundworms have round bodies. On average, they are about 3 to 5 inches long. They live in a pet's intestines and consume partially digested food. Roundworms, also called ascarids, pass microscopic eggs which are found in a pet's stool. The major source of roundworm infection for kittens is from the mother's milk. Roundworm larvae, or immature worms, can be found in the mother's mammary glands and milk throughout the period of nursing the kittens. Both kittens and adult cats may be infected by swallowing roundworm eggs, which contain infective larvae. They hatch in the cat's stomach and small intestine, then migrate through the muscle, liver, and lungs. Eventually, the larvae make their way back to the intestine to mature. When these worms begin to reproduce, new eggs will pass in the pet's stool, and the life cycle of the parasite continues. Roundworm eggs passed in one pet's stool are infectious to other pets. Roundworms are diagnosed by a microscopic examination of the pet's stool. The worms pass a moderate number of eggs, so examining more than one stool sample may be necessary to find them. Occasionally, a mature worm can be found in the pet's stool or vomit. Large numbers of roundworms in a pet can cause a pot-bellied appearance in kittens and weakened adults. Decreased appetite, weight loss, vomiting, or diarrhea may also be observed. Kittens will sometimes die because of serious roundworm infections. Treatment is quite simple. Several very safe and effective drugs are available to kill roundworms in the intestines. Sometimes following treatment, the worms are passed in the stool and easily seen, while other times the worms are digested and not visible. None of these treatments will kill all immature forms of the roundworm or the migrating larva. To effectively break the roundworm life cycle, pets should be dewormed on the schedule recommended by your veterinarian. Generally, at least 2 or 3 treatments are needed. All newborns should be treated at the time of the first veterinary visit. The earlier, the better. Treatment should be given anytime roundworms are detected. Pets remain susceptible to reinfection with roundworms throughout their lives. Roundworm eggs are highly resistant to the most commonly used disinfectants. If a disinfectant such as bleach is used, make sure to rinse and dry the area off, because bleach is potentially toxic to pets. Prompt removal and disposal of all stools, especially in yards, play areas, and public parks, is the most effective means to prevent reinfection. Stools should be removed from litter boxes daily. Roundworms do not cause worms in people, but strict hygiene is still very important. Roundworms do pose a serious health risk for people, especially children, as a variety of organs may be affected if larvae try to migrate through the human body. In suitable environments, roundworm eggs may remain infective to humans and pets for years. Please ask a clinic staff member for further information.